Hello, everybody, and welcome to Afternoon Tea with Docs. I'm Dr. Erica, a GP from the West Midlands, and I'm here with my lovely co-host, Dr. Linda, emergency medicine physician from Sheffield, and we're both lifestyle medicine doctors.
Oh gosh, hello everyone. It's so lovely to see so many familiar faces and so many new ones too joining us today. We love to get to know our guests, so do use the chat box on the right hand side and let us know where you are zooming in from, or what is your favorite hot cup of tea. Maybe it's iced tea if you are in Florida like Monica is today. If you're new to our show, we would love to introduce you to our mission. With our events, we aim to bust medical misinformation and share evidence-based lifestyle practices to help you prevent chronic diseases in a supportive community setting. We host Afternoon Tea with Docs every Sunday at 5 p.m. UK time, where you can connect with world-renowned lifestyle medicine expert, like our guest today, Dr. Monica Aggarwal, a cardiologist with a passion for intervention medicine. Each afternoon tea event is divided into two parts. The first hour is streamed so that everybody can watch it on YouTube, Facebook, and Instagram. And the second half is a 30-minute where you can actually connect with our guest speaker and us and the ATWD community in a private, non-recorded setting, so that we can have a lovely chat over an afternoon tea. And if you want to take your health journey further, you can join our free membership on our website, afternoonteawithdocs.com, where you can continue your health journey and this conversation.
Today, we're speaking to Dr. Monica Aggarwal to learn about the lifestyle tools to stop inflammation triggering chronic illnesses. Dr. Aggarwal is the Director of Integrative Cardiology and Prevention and Clinical Associate Professor of Medicine at the University of Florida Division of Cardiovascular Medicine. She focuses on promoting food as the foundation for healing. And in her clinic, she emphasizes plant-based nutrition and often performs multiple mind-body techniques with her patients, including yoga and meditation. She's also the director for medical education for cardiology, where she directs education for medical residents and cardiology fellows with a focus on prevention, nutrition, and lifestyle. In the hospital, she has multiple initiatives, including developing a 100% plant-based menu for cardiac and vascular patients, and she has published in major medical journals as well. She was named a Next Generation Innovator by Cardiology Today and was also recently named Florida's Cardiovascular Researcher of the Year, which provided her with a grant to conduct the important research needed on nutrition. She's also the author of the book, this wonderful book, Body on Fire, How Inflammation Triggers Chronic Illness and the Tools We Have to Fight It, which outlines prescriptions to help guide people to better health. Welcome, Monica.
Thank you. It's so nice to be here.
It's great to have you here, and all the way from Florida.
Yes, but I, as I pointed out, I was trying to point out, in honor of you guys, I've got my special London mug out. It was very important that this mug came out today.
It's a beautiful mug. What's in it?
I do a load of green tea. So I usually do leaves, and but today I picked the Tazo green ginger. So I felt like a green ginger today. I put a load of turmeric in my tea because of the potent anti-inflammatory benefits. So I've got turmeric in here, a lot of turmeric actually, and the green ginger. That's it, water.
Oh, sounds yummy.
Yes.
So we want to know a little bit about you, Monica. Tell us a little bit about you, how you got into medicine and what got you interested in cardiology.
Sure. So I've been in practice as a cardiologist for about 10 years now. So any one of you who may be in medicine or in science field, or anybody who's starting, knows that after college, you've got to go to medical school, then you got to go to residency, then you got to go to fellowship, and then all your subspecialty fellowships. So by the time you finish, you're old. You feel old the whole time. So, when you go through your training, but then when you finish, you have this moment where you're like, oh my God, I gotta have kids. So I sort of did this rush thing of like wanting to have kids, and right after I did my training. So before I tell that story, let me go back. So how did I know I wanted to be a cardiologist? I had no idea. So I actually come from a traditional Indian family where my dad was like, Mona, you need to be a doctor. And I was like, well, no, I don't want to be a doctor. Like everybody in my family is doctors. I don't want to do that. So I went to UVA, University of Virginia, for college, and I became a religion major. And after studying econ and all these other things, and I decided to be a religion major. And after 2 years of religious studies, my dad said, okay, Mona, this is nice. If you don't get a degree in something science, then I'm going to not pay for your college. So I was like, okay, I better. So I took a minor in biology. And it was it was at the end of my 4th year of college. I decided that I was going to go move to India, and I was going to go live on top of a mountain, and I was going to meditate. And I met a plastic surgeon at the time. Again, those sort of naive feelings you have at 20 years old. And so I met an amazing plastic surgeon who became my mentor, named Richard Edlick, who's now passed away, who had multiple sclerosis, and it changed his career, and he became completely paralyzed. And he taught me a lot about medicine. But one of the things he said to me that always made me laugh, and to this day, is he said, Monica, it's not about finding peace on a mountain. It's about finding peace in the day-to-day. So I tore up my application to go to India, and I stayed at UVA, and I applied to medical school, and ended up in medical school. And all my life, I would say that my life has been shaped by mentors, the people I've met in my life. And my first month in Boston at Tufts University Hospital, I met the most amazing cardiologist, Marvin Konstam, who said, "You're going to be a cardiologist." I was like, "No, I'm not. I'm not doing that. It's too hard." But I loved it. I loved the energy, the excitement, and I loved that I could make people better in such a very important part of their body. And it's been a very special journey. So why I became a cardiologist, because I love that the heart is something that it all makes sense. All the paths make sense. All the channels make sense. And I can make a significant impact. At the time, I thought it was through medications and through stents and surgeries. And it's taken me time to understand that the best interventions I make have nothing to do with anything at all like that. Ironic, of course.
Wow, what a wonderful journey from religion to searching for peace in India, to now being in clinical medicine, and you have this powerful story to share as well about your journey as a patient. And as you said, you being in cardiology and medicine, I think many of us feel the same, that we have to keep sacrificing for the next thing, for the next thing, for the next thing. And I often, like with my husband, we always said, when we finish this exam, then we'll do whatever, or the next step. And then we just think, actually, no, this is our life. We need to start living. It's not about waiting for the next thing to happen. And you tell the story of you being, in cardiology, your training and practice, and you were working really long hours every single day, and then you're coming home crashing, sleeping, and then just to restart it again the next day, and this rinse and repeat every single day, and you put the same energy into your children. Not only were you doing your work full time, you were also raising your kids, nursing full time. You were making their birthday cakes and Halloween costumes. You were doing it all. And at some point, all of this stress took a toll on you. Can you tell us a little bit more about the story of that patient journey?
Sure. I mean, I think when you tell it, I laugh because I think, who is that crazy person who did those things? And like that doesn't sound like me. Oh yeah, that was me. That is me. That is the quintessential me. I think so many of us as women, and I don't think it's just me, physician, cardiologist hat on, but we as women in general, we're mean to ourselves, because we demand so much from ourselves, and we expect that we should be this perfect mother, which I don't even know what that word means anymore, to be this perfect mom who makes cakes and sews costumes and does all these crazy things. I mean, is that like the perfect mother? I don't know. My mom didn't do any of that stuff. Like, what does that even mean? And so I think that what we have these expectations. And I always sort of talked about the club. I'm in the working moms club and I'm not in the home moms club. But I've since then lost that lost that sort of that boundary. I think we're all the same. We're all in our own way. It doesn't matter if you're working or not. We all have these expectations as women, and we want to do everything so well because we have this perception, either through whatever over time, we've got this perception that the mom is the person who bakes all the cookies and goes to all the parties and goes to the field trips. And I did all of those things. So, I came, but I did it. I wanted to be everything. So, and that's what so many of us want to do is, I felt like I had quote unquote delayed so many things in my life that I decided first to have all these kids within a short amount of time. So it started out where I always tell people that I had one baby on the breast, one baby in my arm, and one baby attached to my leg. So that's how I'd come home every day. And I just kind of walk around with these three kids who were like, mama, mama, and I loved it because I wasn't home all day, but I was constantly stressed. So I remember days where I'd call my husband and say, hey, Rob, my husband's name is Rob. I'd say, Rob, don't feed the baby because my breasts are humongous and I either have to pump or I have to feed this child. And he's like, the baby's crying. I was like, I don't care. I'm coming. And so like driving down the road, I mean, it's crazy stuff we do. And I'm speeding down the road because my breasts are leaking milk. I mean, it's too much information. Sorry, that I'm leaking. And then I'm going to like, okay, feed the baby so I can just sort of not have to pump, and I had this aversion to my breast pump. You just have these funny things that happen. But it's true. I tried to do everything. I did make cupcakes at midnight. I did puree sweet potatoes. I did switch my entire schedule around so that I could make it to a party and then the party gets canceled. I would do these crazy things where I'd go wake up at 4 o'clock in the morning almost every morning. I'd go for a run early before everybody'd wake up with these massive breasts. Can you imagine? Jesus, I don't even know how I did it. And but you do these crazy things. And I would sleep 4 or 5 hours a night and I would just do it again, rinse, repeat, rinse, repeat. So everybody thinks, and I thought that it didn't matter, and I think this is another fundamental problem, is that we think that eventually, oh, well, it's okay. We'll just sleep a little bit less. It doesn't matter. And you don't realize that you're slowly fraying it at the ends, and all this internal inflammation is building in your body. So I was stressed all the time. I was answering heart attack calls. I was 4 months postpartum. I only took 8 weeks off per child. I had all these babies running around. I was trying to do all these things. It's exhausting just even saying it. So what happened? I fell apart. I fell apart in the worst way. I was a runner, and I went from being an active runner to being completely immobilized within just a couple of weeks. I remember the day that it started. I remember the time it started. I remember because it's always the same. I kind of massage this finger sometimes, and I always wonder, oh my God, is that because I'm having pain? But I remember I had a joint that just started swelling. And I remember thinking, oh gosh, I must have hit it somewhere, and I ignored it. And then I remember that it migrated, and it was like a shoulder, and my shoulder was hot, and I couldn't lift it. And then I remember that it would migrate down to my knees, and then it was my feet, and my feet were the worst, where I remember it felt like glass was cutting my feet. So I changed my shoes 3 times. Of course, I wasn't the problem. The shoes were the problem. So I changed my shoes 3 times. And I remember I wanted to write letters to baby clothes companies because I couldn't snap. I couldn't do that fine snapping motion to snap those bloody baby baby clothes, and I wanted them to make those ties so I could make them easier. And I wanted to write a letter to Carter's or Baby Gap or one of those places to tell them that this was inappropriate. So about 4 months after, or 5 months after I had the baby, I remember a day in particular that is probably the darkest moment, which is when it was like 4 o'clock in the morning. Alarm went off. I went out to let the dogs out, switch off the alarm. I needed to pump, nurse, make the baby, the daycare, kids that go to daycare, I need to make their lunches. I need to make my lunch. And then I got to feed everybody breakfast. So I usually had to get up that early to do all that. And I remember that the baby cried, and the baby sleeps next to the other 2 kids. And so I was like, oh God. So I started running to go up the stairs, but I couldn't run. I couldn't run up that day. I actually crawled up the stairs that day. I remember that moment so well because I was crying, the baby was crying, and my husband woke up and came over to the baby's room, and he sees me there laying on the floor, unable to reach the kid. And because I couldn't get my body up to get into the crib, let alone lift the baby with my shoulders. I was so inflamed. So he brought the baby down to me, and so that I could nurse her. And that truly was the darkest moment. To this day, it's hard for me to tell it without looking down and thinking how hard it was. So I went, within a few weeks, I went from being, at that point I knew I had a problem. But I didn't handle it well. I did what any good doctor does, which I treated myself for Lyme disease. I thought I had migratory joint pain, so I must have Lyme disease. And so I started antibiotics, and I didn't get better. I got worse. I ultimately went to the rheumatologist. I had an internist of my friend of mine draw my blood. My inflammatory markers were through the roof, and I was diagnosed the next week with advanced case of rheumatoid arthritis.
And wow. I mean, you talked about breastfeeding and that you said, too much information. I don't, absolutely not, because it's the reality, isn't it? Reality that we need to hear about actually, and talk about. And I mean, actually listening to that, I feel exhausted just hearing all the things that you had to do. There was just literally nonstop, so many things going on. And it definitely sounded very, very full on. And you mentioned you got diagnosed with this advanced case of rheumatoid arthritis. And I think you said that actually you were told to stop breastfeeding straight away, to stop nursing straight away. What sort of kind of emotions did it bring about for you?
So I was in Maryland at the time, and I went to Hopkins Hospital, I remember, because I felt that I would only listen to, and I only went to see the chief, because I thought I will not agree to anything. I was kind of probably cocky and a jerk. I don't know. I'm not sure. Or I felt that I needed to hear it from the chief, and that was the only way I would be able to understand. So I remember it was this man who came to me, and he said, "Look, yeah, you got rheumatoid arthritis. It's pretty advanced. You're pretty debilitated already, and it's going to get worse really fast. So you need to get started on medicines by the weekend. So you need to stop nursing today." And that's it. And I remember that moment, because I remember how angry I was looking at him, and how small he made me feel, and how insignificant my need to nurse the baby was. Like, okay, well, you just have to stop. Like, that's it. You're done today, and you'll wean for a week, and then you'll take your medicines. And he's like, and then as a patient, God, I'm the doctor patient. Like, I know so much, and yet I just felt so small. And I think, God, even with all the knowledge I have, how small, and how we treat people. It's just, I remember that day that I will never treat somebody like I was treated, where I felt the worst thing is he made me feel like I had no hope. He said that, that my numbers were so high that he didn't know how things were going to go. He said, I'll never come off medications, that this is incurable illness. And, even if those things are true or not true, you should never take away somebody's hope. And I think that's what I learned from that experience, is that I never want to feel like that or make anyone ever feel like that. So there was a lot of emotion, a lot of sadness. I mean, every time that baby cried, I walked away. That was the hardest thing to do. I mean, you're leaking milk and walking away, knowing that you could feed your kid, and my husband would have to put a bottle in her mouth. And it was horrible. It was a dark time of my life, one where I had these small kids. I wanted to be able to provide for them. I felt I couldn't. I felt inadequate in every way, and I was so in pain. It's funny because to me, it seems like if you just have a little bit of joint pain, like what's the big deal if you think about it? But when you actually feel it, it's so tiring to have all these joints hurt like all the time. And so you don't want to get up, you don't want to walk, you don't want to do anything. And then you lose, you're tired. Even when you're sleeping, your joints are hurting. So you don't sleep well, which makes everything so much rougher. You feel like you're a rock, and you can't sort of soften up, and and it's a weird feeling. So a lot of those kind of feelings of inadequacy that many mothers feel in general, and then mothers with illness feel even more so. I had all of those feelings.
Well, I can actually relate to the kind of joint pains that you're talking about. Because although I don't have rheumatoid arthritis, I've suffered with joint pain since I was little. I remember as a 4-year-old going to bed, and I would be quietly crying in bed because I was in so much pain I couldn't sleep. I do have degenerative arthritis. Who knows why? But that kind of joint pain, when you cannot sleep, you can't do anything, it really is intolerable. And without actually having experienced that, I think sometimes as a clinician, if, for example, your rheumatologist, the chief rheumatologist, if they've never actually experienced that kind of pain, it's very hard for them to empathize and really understand what the patient is feeling.
Absolutely.
And I think you mentioned in the book that actually with all the medications that you were taking, actually, what medications were you taking?
So the standard of care, at least back 10 years ago, was methotrexate and prednisone. Those are sort of usually the standard medicines you get started on for autoimmune joint disease, specifically rheumatoid, which is what I was started on. I had a lot of side effects from them. And my hair fell out, and I had a metallic taste in my mouth all of the time. I was pretty anemic. People admired me because I lost my third baby weight so fast, because I just had so little interest in eating because of that feeling in your mouth. And, I've had to take HIV medications before when I had a needle stick back in residency. And I remember that same metallic taste. And I wonder, and I used to laugh at people not being able to be compliant back until I took those. I remember those HIV meds, and I remember thinking, oh my gosh, like this is why, because these suck. And so when I was on all methotrexate, I think they switched me to leflunomide. They tried me on a couple of different orals, and ultimately methotrexate worked the best, so I stayed on it primarily through the course. I never got on biologic therapy because my symptoms were well controlled on methotrexate.
Yeah, and methotrexate and prednisolone are pretty common medications that we treat rheumatoid arthritis with here in the UK as well.
Right.
And you talked about all those side effects, and obviously with the pains that you were experiencing, and things that you could do before that you couldn't do anymore, like you were a regular runner and you were having difficulty walking and everything. And I think you mentioned in the book how you got more and more bitter and more lost, and actually started to blame your daughter, thinking, if I hadn't had my third child, maybe this wouldn't have come about. That must have, that's a lot of powerful mixed emotions in there.
The book is, so yes, all of those things are correct. I think when you get sick and maybe you have this feeling in your 20s and 30s of invincibility. And I used to be surprised when my kid would fall and he would bleed, because I forgot that there's this, that you actually can get hurt. I know that sounds ridiculous, but it is sort of like this invincibility feeling that so many of us have, that we're going to be like, if you just do all the right things, you're going to be okay. Well, the right things is always, whatever that means. And so I think that I fell very hard when I got sick. And I think it was just a bad time of my life, in the sense of, like, I just let everything degrade. It didn't have to have been that bad, but everything got so bad. And I definitely had a lot of bitterness, and thought, I tell my husband, I said, why did we tempt fate, whatever that means as well? And why did we try to have this third kid? Everybody told us 3 kids. Why are you having 3 kids? You already have a boy and a girl. Maybe we should have listened to them, And I thought that it's because I had this third kid that I had done this, or this had happened to me. I was angry. I was bitter. I was in a dark place, and it had taken me years to understand that bitterness was so misplaced, and it was so sad that I had that negativity and feeling towards my youngest daughter. And I tell her all the time that she is not, because she has read that chapter, and she came to me a year or 2 ago and she read that chapter and she cried and she said, Mama, I hurt you when I was born. Boy, was that hard to hear. And I said, baby, you've no idea how much you've saved my life. Because if it wasn't for you, I would never be where I am today. I would never be as healthy and as strong as I am. And you are the one who saved me. And it's hard to tell that story because it's embarrassing, it's raw, it's ridiculous, but it's all of those feelings that we sometimes feel when we're down and hurt. And I was those things, but it was truly that. And my daughter knows now that I believe that she is my savior, not the one who hurt me.
Wow. Thank you for sharing that. I'm in tears. I don't know if you can see.
It was a tough time.
Yeah, I bet. That must have been very, very difficult to go through all of those emotions. But it's real life, isn't it? And earlier you said, about being the perfect mum, and you think that, I can't have these feelings, but we do experience different things. And sometimes we experience very negative emotions. There's no right or wrong. It's just what we feel. And we get to feel those feelings, and we get to understand them. And then we get to face them and then move on. But without actually acknowledging them, then we'd never actually be able to move on from whatever we're feeling at the time. And I loved your analogy in the book where you mentioned about the human body comparing us to a phone battery. Like, as you were saying, you were working, flat out. You had your 2 kids, and then you had your third daughter, and all of this is, constant. This stress on top of the stress, this creates this chronic stress, but but you're not letting your body recharge. Whereas when our phone battery is at 7%, like you said in the book, you'd be, panicking, looking for, somewhere to charge your phone, whereas we don't tend to do the same with ourselves.
Yes, so, that's probably the fundamental problem, I think, in our society now starts with that concept. If you get into the science of it, you look at the body and you say, well, we have this autonomic nervous system where it's supposed to just sort of takes care of all of our bodily functions, our heart rate, our blood pressure, all the things we're supposed to do. And that can break into these different nervous systems. Some of them are to help us in times of stress. The sympathetic nervous system, which we call the fight or flight, or the parasympathetic, which is that rest and recovery or rest and digest. And most of us in 2021, we live in a constant state where our sympathetic nervous system's on overdrive. So we are always in this. So, there's a purpose for a sympathetic. Like you see a tiger in the old days, or maybe your kid is falling and you want to run to the kid and catch the kid, or you're running from a robber and you're cut yourself in all these bushes, but you don't feel the pain, right? Because your pain receptors are all blunted in the setting of stress because you gotta run. And you don't think about urinating when you gotta run, and your stomach doesn't hurt and tell you you're hungry because you are ready to go. And that's just the way your sympathetic nervous system is supposed to be. And then you have, after that kind of thing happens, you recover, and you have a parasympathetic nervous system where all of a sudden your body starts slowing down again. And it says, oh, okay, I actually hurt my arm here. I'm hungry. I need to refuel. I need to go to the bathroom, all this stuff. And, these are supposed to be in balance. But most of us are living in a state of sympathetic overdrive where we're constantly moving, constantly doing, and we're not giving ourselves enough time to recharge. And that's why I use that phone battery analogy, because we charge our phones like, oh my gosh, my battery's out of phone. I gotta go charge it. And we go put it and we let it relax, isn't it? We let it go and sit and recover. But we don't let ourselves recover. I ask people often in my clinic, what's the last thing you do before bed? And 9 out of 10 people will say, well, I look at my email and I check my social media. And then I'll ask them, what's the first thing you do when you wake up in the morning before you get out of bed? And they'll say, well, I grab my phone and I check my email and I check my social media. Like, it's this constant state where we're always on. Some people wake up in the middle of the night and they'll tell me that they can't fall asleep. And I'll ask them, well, what do? They pick up their phone and they check their social media. Is there so much going on social media? I don't really understand what we're doing at all these hours checking social media. But that's exactly what we're doing, is that we're always on every moment. Even we take these bursts of our body needs 7 to 9 hours of sleep every single night. Most people are barely sleeping 6, and people are waking up in the night to go to the bathroom, whatever, and then they check their phone. Some people get up to eat. All this stuff is affecting all of our ability to recover and recharge. If you don't allow your body to recharge and you're always in sympathetic drive, you will create inflammation. It's just the way the body works, and you don't notice it. That's the tricky thing, is that inflammation at the beginning, it's insidious. It just kind of slides into your body. It happens internally. You may feel some non-specific symptoms, and that's also part of the problem, isn't it? We feel tired. We feel, I just, headachy, my shoulders are hurting, all these sort of non-specific complaints. Or lately, I don't have a lot of energy, which is a lot of times what people describe, but those are just sort of insidious ways inflammation is entering our body. Why don't we allow ourselves to recover? We've lost that ability. We've forgotten how to recharge.
Mm-hmm. And you mentioned, stress, talking about stress. And he said in the book that stress is as a body's response to a demand for change. And actually, you have eustress and distress, and acute stress, chronic stress. And you mentioned inflammation. We have acute inflammation and chronic inflammation. Stress and inflammation aren't necessarily bad for us. So could you just elaborate on that a little bit?
Sure. So there's, 6 big concepts you mentioned there. So if you break stress into eustress and de-stress or distress, that's sort of an old concept. Hans Selye, or Sale, he's the one who came up with this concept, which is basically your response to different types of stress. So a eustress is your response to a positive thing that happens in your life, like a birth of a child, which could eventually become de-stress also because of the lack of sleep, etc. But at the beginning, when the baby comes, or a promotion or a marriage, those are sort of eustress. And de-stress or distress is typically things that are going to cause trauma to our bodies, things like losing a job or a broken relationship. Those are things that cause distress. Well, the problem with eustress and de-stress is that eventually, we all have moments of both of them. The goal is obviously to have more eu than de-stress, but so much of the time, the longer you have any of those stresses, they become sort of more chronic and they become inflammatory. So you've got eustress and de-stress, and then you brought up acute and chronic inflammation. So despite the stress, eustress is typically a short-acting stress. Usually you have this great joy, and then eventually it just sort of subsides. Unfortunately, de-stress often has the ability to become more chronic. And so let's break up the concepts of acute and chronic inflammation, and then we'll go back to how stress fits in. So acute inflammation is, I hurt my leg, I scratched my arm, and your body sends an inflammatory reaction to it. Well, that's very normal. You need that. You need inflammation because you have a cut, and you got to send over, oh my God, I got to send over all my white cells and I got to clear up the infection. I got to send over the platelets. I got to heal the area, and I got to send over, and all that causes inflammation. That's why you get swelling. I have a big swollen, actually my bees bit me. I got a bite this weekend. And so I have a big swollen arm. So that's all inflammation. If you can see my joint, my arm is all swollen. And so that's all acute inflammation in response to an acute event. But when you have this constant state of de-stress or constant amounts of stress that happen for a long period of time, that acute inflammation becomes chronic. Well, what's the big deal? Well, in acute inflammation, your heart rate goes up short time, your blood pressure goes up, your inflammatory cells come over, they heal the problem, and then they go away. But then if you have inflammation for longer periods of time, it becomes more chronic. Then you have all those cells that are hyperactive for long periods of time. And they don't just stay in this one place, then they move to other parts of your body, and then they can trigger inflammation and illness in other places. A perfect example of this is celiac disease. I like people to think about celiac disease in particular because it's such an important way to understand how what you do acutely can affect you chronically. So celiac disease is allergy to gluten or wheat gluten. And so people who don't know they have celiac disease will often eat wheat for years. And so they eat wheat. So they have a genetic predisposition where they cannot eat and process gluten. That's different than gluten sensitivity, which if you want to talk about later, we can, but this is gluten allergy. That's a very distinct thing. That's celiac disease. So when people eat wheat, initially what happens in their gut, and again, we're getting into the gut, which is a whole nother talk, but when you have in the gut, what happens is you break open your gut cells, and all of the inflammatory cells are triggered by that wheat. That wheat comes into your body, it enters your blood, the toxins enter your bloodstream, and your body mounts an acute attack, and it attacks the gluten, and you get a little bit of inflammation. So that's okay. But what happens is people who don't know they have gluten allergy, they continue to eat it over and over again. And so what happens is that it goes into that gut again, breaks those junctions, gets into the body, all the toxins get in the body, and that lasts all for hours and hours and hours. And you get this chronic state of inflammation with these patients with celiac disease. But it doesn't just sit in the gut where you ate that wheat. It goes everywhere. And that's important to understand, is that inflammation goes to your joints and you get joint pain. It goes to your head and you can have seizures and headaches. It goes to your skin and you can have rashes. So celiac disease is a perfect example about one thing that you eat goes into your gut, but doesn't just affect your gut, although it affects the gut, but it triggers a systemic inflammatory process. So there's so many things that can happen where you create this chronic inflammation, which then triggers this sort of systemic illness. For me, autoimmune or rheumatoid arthritis. And so everybody everybody has their genetic predisposition. So that's going to trigger whatever that predisposition gets activated, and they're going to be more prone to that illness. So you said eustress, de-stress, acute and chronic, and you brought up two more.
Acute and chronic stress and acute chronic inflammation.
Okay, so again, just to sort of emphasize, acute inflammation is not bad. Inflammation in the acute phase is not a bad thing. We need acute inflammation. We need to be able to live. That's how we handle all of our acute problems. The problem is no one just has acute inflammation anymore. We have so much chronic inflammation because our bodies are constantly in these states of de-stress, where we're constantly being forced to deal with all these inflammatory states for hours and hours and hours, which then is creating systemic illness. So it's kind of a chain to kind of think about, is that one thing leads to another, which leads to another. So the key in medicine, we say, oh, well, we'll treat the illness, because that's the downstream. And that's, we as scientists, we see the illness and that's what we want to treat. But wait, why did that person get that illness? Why did I get rheumatoid arthritis after I had my third kid? Let's go back a little bit and say, let's find the triggers back here, which triggered the inflammation, so that we can then suppress the illness.
Absolutely. And when you actually think about it, I think almost all medical conditions that we see on a day-to-day basis, you mentioned celiac, we see, and you as a cardiologist see a lot of heart problems, diabetes, whether it's other gut problems, whether it's COPD, lung problems, or arthritis. All of these, when you really look into it, the disease process, it starts with inflammation, and inflammation underlies all of these conditions.
Absolutely.
And so you talked about lots of different tools in your book to help reduce inflammation. And there isn't one set of tools for heart problems, one set of tools for diabetes. They all, they all act on the inflammation, the root cause. And so you can improve almost all of your medical conditions with the same practices.
Yeah, I think that's a very important thing. I'm glad you said that, Erica, because so, I sometimes when I do these slideshow, I usually show a slide where I show that all illnesses are kind of tied by one, around one tie, which is that inflammation point. And so as a cardiologist, I use absolutely the same tools, different things for different people, but the same toolkit to treat patients with heart disease, because heart disease is an inflammatory condition as well. I'll just give you a brief explanation of what that means. So if you have a heart artery that's a pipe that goes like this, and usually when you're born, your pipes are nice and clean and juicy like that. And so when you exercise, your blood vessels expand, and when you are not exercising, they go back down. That's normal. If you have good endothelial function, some people have heard that term, so I say it, the cells on the inside lining right here, the most outer layer of the closest to the blood basically is the endothelial layer, and those are dilate and expand and decrease based on what you're doing. But what happens is that over time, if you develop, arguably your lifestyle affects these risk factors for heart disease, plus your genes, you then cause this damage in these blood vessels. So they're really soft and smooth, and they get a little damaged. They get these little cracks in them. And your body's like, oh my God, I got to get some platelets over there. So it sends some platelets over there to heal up the crack. And so then you get these little scabs inside your blood vessels. Well, you can see what's happening to my blood vessel. It's all of a sudden not as big as it used to be. And all those endothelial cells, which are really good at doing this, are kind of like, I can't really do that. So then what happens is you get high cholesterol, and you get you're a smoker or some other things, and it starts making that scab get bigger and bigger and bigger. Well, if the scab's here, who cares if it's this big or this big? But when it's in a hole or in a pipe, it matters. But here's the rub. Most people in their 50s and 60s have some level of mild plaque in their heart arteries. I just tell people to accept that's probably the case based on what they may or may not have eaten when they were kids. Not everyone, but they're going to have some mild plaque in their heart. But these mild plaques don't cause any problems. But what happens is that these mild plaques, they can rupture. And they can rupture because something irritates the plaque. Well, what irritates the plaque? Well, we've now shown that inflammation irritates and ruptures this plaque. And what happens is the plaque goes from being this tiny to and blocking the whole blood vessel. And that causes an acute heart attack. And that's when we take people emergently to the heart lab, and we go and we take care of and we open those blood vessels with stents, and we have to do that all of the time. Well, people say then, well, why don't we solve this problem by just stenting all these little plaques? The problem is people have hundreds of them. You'd be stenting the entire heart arteries, and the stents don't make your life better. The only thing that makes your life better, that makes you live a longer life in heart disease, is lifestyle. It's amazing. Medications and lifestyle are the only thing that make you live longer, not stents. And so what you have to do is you have to calm this inflammation with medications and lifestyle so that that blood vessel plaque that doesn't rupture. So going back to just heart disease briefly is just to sort of remind you that yes, heart disease also is an inflammatory condition. And all of these illnesses, if you treat the tie in the middle, which is that inflammation, you treat so many problems. And you use the same toolkit, and we have this toolkit. Yes, some people need a little more of this or a little less of this, but the toolkit is the same.
Yeah, and you go into a lot of detail about the toolkit in the book. Before we go into some of these toolkits, I'm just going to hand over to Linda to go more into the nitty-gritty of things.
Thank you, Erica. What an amazing story. And you have mentioned about inflammation, and I would like to highlight what you said really nicely in the book, that it does matter at what age we started. And we have shown that our lifestyle actually affects already young children. And you highlighted a study where unfortunately younger soldiers, after they have passed away, we have seen that at a young age of 22, we have seen plaques formations in their arteries. So it's not a disease of the old. So it's very important that we start young with our lifestyle, right?
Absolutely. I mean, I like people to think about it. It's, because I see so many patients that are older and they're like, oh, great, I'm screwed now. No. So, you're at any point in your life, change is good. Very important. Change is good at any point in your life. But the sooner you get to people, absolutely will make more impact, because there's so many concepts of things like lipid years. The sooner you get to somebody's lipids and get them aggressively down, then you can change their trajectory to heart disease. If it's more like this, and then you add in a lifestyle component or add in medicines, you can change their risk of mortality by just adding things in at an earlier age. So if I get to people here, it kind of changes here. Whereas if I get them here, it goes so much lower. So the younger you get to people, absolutely. I mean, we've started seeing fatty streaks in 6-year-olds and 7-year-olds who die of leukemia. So we're seeing cholesterol deposition at very young ages. There is no such thing. There should be no thing. Oh, they're just kids, it's okay. Well, I don't know what that means. I think that kids need to eat the way they have to. If you develop the healthy habits in children, then they'll have those healthy habits for life. It's easier for them then to eat healthy later in life, because they've always eaten that same way. If you allow them to eat all these McDonald's type of foods and then you take it away, they really feel they've missed something, and you haven't helped them. So I always tell people that our goal in life should be to teach our kids at a young age to eat healthy. My kid, I always tell this story. It's always sort of a funny thing. I remember my son was like 7. He goes, Mama, I don't like kale. And I said to him, honey, I know, I love you, but I don't care. And so it sounds harsh, but it's not meant to be harsh. It's because it's just saying, like, you know what, I get it. It's not something that you feel as smooth as mac and cheese or whatever you're thinking of, but it's so good for you, and it's good for your gut, and it's good for your body. And I'm going to give you a longer, healthier life. So we're going to eat it. And my kids eat plain spinach every single day for their snack.
And that brings us on to the microbiome. One of the biological factors that we can actually influence in our life. And when we're talking about the microbes in our gut, could we differentiate what is the microbiota and what is the microbiome? And why are they so important when we're talking about lifestyle medicine?
Sure. So I think the gut is so fundamentally crucial to every conversation about why diet affects inflammation, but arguably all lifestyle. I mean, there's studies about how different types of yoga can affect inflammatory markers and affect your gut. I mean, there's just so much out there now. But if we specifically look at diet, because that's the most easy maybe to understand and we know the most about. So you have these bugs all over your body. We can't see them. They're all over your skin. They are in your vagina. They're on your penis. They're all around your anus. Sorry, I'll tell a really random funny story. When my son was 5 years old, I told him about that the butthole is the anus, and he, in the middle of carpool one day, he goes to his friends. He goes, "Guess what, guys? Do you know what your butthole's called?" Like in the middle of carpool, I'm like, oh my God, I'm gonna get 5 calls today. 5 other kids are like, what? It's your anus. So anyway, sorry, it's sort of a funny little story. So all of those areas of your body have these bugs. They're bacteria primarily, but some are fungus and some are virus, but in general, and all in your colon, you have these gut bugs. Those are the microbiota. And then all of those bugs, the goal, there's so many, we don't even know all of them yet, but we are trying to figure out what all of the bugs are. But we do know that when you have a lot of different microbes or bugs in your gut, so we call that microbial diversity, then you are going to have a healthier gut. In fact, we do know that people who have less microbial diversity, so all the same kind of gut bugs, those people actually are more prone to chronic illness. So that's been shown already. So what we know that people who eat foods that are high in fiber, fermented foods, mostly plant-based, are people who have a lot of microbial diversity. And that microbial diversity is very important to keep a strong gut lining and decrease attack into the gut, getting those toxins into the body and keeping the inflammation at bay. The microbiome is very interesting. The microbiome is the genetic material. It's the genetic material that each of those bacteria have in your gut. So like, that's kind of crazy to think that your bacteria have genes, but they do. And all of those genes, so if you have all these trillions of bugs all over your body, which you do, then you think about all the genetic material that all those bacteria have, which they do have, you really are more bug than you are human, because you really are. That's why people sometimes call the gut your second brain, because there's so many things that happen that actually that genetic material from those bacteria can affect your body. For instance, your bacteria in your gut can make serotonin. Well, serotonin is your happiness hormone, and you can make serotonin in your gut. And dopamine, which is your get up and go, and histamine, which is an allergic response mechanism. Some of that stuff is made in your gut. And so how your gut bugs are and what they make then can impact your whole body. So it's really a fundamental and fascinating thing to think about, is that you can eat foods that can affect the bugs that are in your gut, which then can affect the DNA that they have, which then can affect how you feel.
It's really fascinating, and a new arm of science that is just going to keep giving. And there are 2 gut bugs that I would love to bring up, the Prevotella and the Firmicutes. And there was a really good study between the African Americans and Africans. Can you tell us a little bit more about that and what worked?
Yeah, so for those who are love to look things up, that's an O'Keefe study, and they only looked at 20-25 people, but it's a great study, because what they did was they looked at Africans and African Americans. So the Africans were eating the standard village diet, which was a primarily plant-based, very high fiber diet, not completely plant-based, but primarily plant-based. And again, we could talk about, whether somebody needs to be 100% plant-based, et cetera, as well. That may be something people are curious about. But in that study, in the African study, so they looked at those patients, and then they looked at the African American population, who was specifically the African Americans who were eating a primarily standard American diet. And the standard American diet, we call it the SAD diet. I guess you call it the SUD diet, standard UK diet, but we have the SAD diet. And when we call that, which is just a very refined, low fiber diet. And so what they did was they looked at the guts of both the Africans and the African Americans. And what they found were that the Africans had a very strong gut. They had countries, they had a very high amount of, say, Prevotella, which is a very good gut bug. And we find that in agrarian or farmer kind of societies. And in the African Americans, we had more of the firmicutes. And so, well, and then what we also found was that the Africans had a load of short chain fatty acids. Now, short chain fatty acids are important in your gut, and you may have heard of butyrate in particular because that causes a lot of gas. And so people always joke about it, at least the kids always do. And so those short chain fatty acids, the higher number you have, the more they've been shown to be antioxidant, anti-inflammatory, super, super important to have a lot of short chain fatty acids. What's interesting is that the Africans had loads of short chain fatty acids and the African Americans had really low amounts of short chain fatty acids. So then if you look at their inflammatory markers, there was a lot of inflammation in the African Americans and not in the Africans. And then they did colonoscopies on these people, and they found that the Africans had almost no polyps in their gut, whereas the African Americans had polyps. And so you could say, well, who cares? That's the genetics are different in the African American and the African, so that doesn't mean anything. So they did the best thing ever. They switched their diets. So they gave the Africans the African American diet and the African Americans the African diet. And what happened? Well, what happened was the African Americans all of a sudden started building short chain fatty acids. They started having more microbial diversity. They started developing more Prevotella, and they had decreased inflammation. And then with people, and what they found when they did their colonoscopies, they started seeing regression of all those inflammatory markers around those polyps. I mean, it's so cool. And the best part, and then what they found, the Africans, when they gave them the African American diet, the reverse happened. They started losing all those short chain fatty acids, and they started building up more inflammation in their gut. And that happened within 2 weeks. And I emphasize that number because within 2 weeks, you can change your gut flora. I mean, that is amazing to think about. Look at the guys. It's an O'Keefe article. I'm forgetting the art journal right now, but I can look it up if your parties are interested.
I found that story, the research, really fascinating. And
fascinating.
We have more and more studies that are actually supporting this evidence. And what I found really interesting as well, what you shared, that aging seems to have an effect similar to a Western diet, as you just mentioned. A Western diet that is low on fiber, high on fats and sugars, and the increasing the proportions of firmicutes in the gut. So aging in the Western diet increased this Firmicutes microbiome. And these changes relate directly to the hardiness or the frailty of the individual, and with the diversity of the microbes decreasing as illness increases. So as we age, it seems like also our microbiome changes to the one that we actually fuel with a Western diet. It's a pretty shocking finding.
It's amazing. It's amazing to think about aging, and people often ask about Alzheimer's disease. And Alzheimer's arguably is an inflammatory condition, and there's so much being discussed about telomere length and the length of the telomere, which is basically the shorter the telomere, the sooner your biologic life will decrease. And if you have long telomeres, that's better for your body. That's what we're learning now. But it seems like inflammation is all tied to telomere length. I mean, and so there's just so many things that even in the last couple of weeks, I'm blown away with the amount that's happening in terms of telomeres, gut flora, inflammation, like it's all coming together, that it's all tied together.
And so we have a biological system. We have these friends in us whom if we feed them well, they're actually going to support our immunity. They're producing the vitamins, the short chain fatty acids that are supporting our health. So every single time we eat, we can fuel our health, or we can fuel our disease. So we are really empowered, aren't we?
Absolutely. And, there's no time like the present. And I emphasize that because you can start these changes, you can start them today. So I will share with you that I've had a recent move and a lot of stress again in my life in the last couple of weeks. And with that, it was very interesting. For the first time in 10 years, my third finger started inflaming again. I haven't had that happen in 10 years. And I thought, oh my God, it's back. And I had to have a little bit of I had one of those moments where I started getting dark again and getting nervous again, like, oh my God, it's happening again. And then I had to stop and say, okay, what actually is happening here? In 10 years, I haven't had any problems with inflammation. What happened? And well, I went through a move. I had all this stress. I was going through a lot of job changes, a lot of life changes. I wasn't taking care of my gut as well. I wasn't eating as well. I had done a little bit of junk food, junk food that that wasn't helping my microbes. And so about 3 or 4 weeks ago, this happened about 4 weeks ago. And then I have been amazed because all I've done over the last 4 weeks is I started sleeping again. And I started nourishing my gut flora again meticulously, making sure that microbial diversity was elevated again, and all of my inflammation is gone. And so you can make those, and I was kind of blown away because I was like, oh my God, it actually works. I mean, I know it works. I've done it before, but again, every time I do it, I'm like, oh my God, it works. I cried, because you can be empowered to change today. You can make changes this minute on what you do. And the inflammation was starting again a couple of weeks ago, and I had to go back and say, what am I doing? And kind of really examine who you are and what you've done and how you can fix it. And a lot of that, you need health coaching or wellness or a physician. So find that person and work with them and change your body. It's not going to happen immediately, but you can change your body and get better. You may not come off all of your medications. You may or you may not, but you may, and you may get better or cut back. I mean, you have to be empowered and know how to do that. I haven't taken a single medication for rheumatoid arthritis in 8 years. And so I want to empower people to say, you can absolutely change your life and make your body better. Will you cure your cancer? Sometimes people ask me that. I don't know the answer to that. I would say that overall, though, I know that some people ask me, will I, like you, not have rheumatoid arthritis? I don't know. Everybody's bodies are so different, and you have to work with somebody, but if you pay attention and be meticulous, you can absolutely get better.
It's very empowering to know that we can make these changes, and I have seen it on my own body, which is a completely other story, but certainly have seen it, and that's why we are so passionate here, because we can see it on ourselves and on our patients, and it's very cost effective. As you are an amazing cardiologist, I would like to take the interest a little bit to TMAO, trimethylamine and oxide, and see what is choline and carnitine. Where do we find these, and what is TMAO?
So TMAO is this really long, annoying word. And so we're just going to, just think about it like this. There are certain foods that have phosphatidylcholine in them, and phosphatidylcholine is found in lots of foods, plant food and animal food, but primarily it's in high amounts, it's found in animal foods. So there was a study done and it was published in one of our biggest journals. And what they showed was they made people eat foods that are high in phosphatidylcholine. So they gave them the steak, cheese, eggs. Those are things that are high in phosphatidylcholine. Well, when you eat those foods, what could happen is that it will go into your gut and it creates pre-TMAO, and then it goes into your liver and it makes TMAO. So who cares? What is TMAO? Well, we know that TMAO, the higher amounts of TMAO that you have, the higher risk or higher likelihood. So if you look at if you have a graph and you look at it by people, we want to be low on the graph, we want to be down here. The people who had the highest amount of TMAO that were up here, they had the highest rates of heart attacks, strokes, and dying. And so we know that there's a link between TMAO and that. Now, I'm not saying it's causative. If you have high TMAO, you will die sooner. I don't know the answer to that. We haven't figured that out. We do know, though, that if you have high amounts of TMAO, you're also higher risk for those illnesses. So what they did in this study, which is so cool, is they gave people these animal products which are very high in phosphatidylcholine. And what they did is they followed their TMAO levels, and they were able to show that people who ate those foods, if you were an omnivore, then you would have a very high level of TMAO, and it would go up within 12 hours of eating. Within 12 hours of eating, you would have elevated levels of TMAO. And again, higher TMAO is associated with higher rates of heart attack, et cetera. So what's interesting, and another interesting part of that is they also, which I don't know how they did it, but they got vegetarians and vegans to eat that high phosphatidylcholine food. So basically they made a vegan ate a steak, which is amazing. So they made them do that. And when they did that, their TMAO level did not go up. That's incredible to think about. And why didn't their TMAO level go up? Because they ate the same food as the omnivore. Well, our thinking, and this is that they had different microbes, they had different gut bugs, and their microbial diversity was less or different, which is why they were unable to make TMAO. And so they didn't have the same response that the omnivores had. So we know that animal products in general make your TMAO level go up, and that's not a good thing. So in general, we want people to avoid eating animal products as much as we can.
So we have talked about so many incredibly interesting pathways that are changeable with what we do with our daily lifestyle. So let's talk about the lifestyle and nutrition that we have to kind of slowly or fast bring into our daily habits that can affect us positively and add health gain.
Sure. Specific dietary things to change, is that what you mean?
Yeah, and any lifestyle measures that you have listed in the book as well.
Oh, sure. So broad things, let's go through them broadly first. So I think diet is very, very important to change in terms of improving your lifestyle. The goal should be, if we talk about diet, is that you should go away from more animal products and eat more plants. Do you have to be 100% plant-based? I don't know. Would I like everybody to be plant-based? Yeah. But the goal and what I'm trying to get people to do is eat more plants. I want to get people to get a little bit more away from this side, which is more animal products, more refined foods, and eat more whole foods, more plant-based foods. So that's one thing. We want to have people eat more plant-based foods. But it's not just plant-based foods, because Oreos are plant-based. Coca-Cola is also plant-based. So we want to eat whole foods that are very high in fiber. We want to eat a lot of fiber. We want to eat a lot of fermented foods, because those foods have probiotics, which really replenish those gut bugs. And when I started getting inflammation again a few weeks ago, I added in a load of kimchi, which is one of my favorite fermented probiotics or fermented foods. So it's very important to add in foods that are high in fiber, lots of fermented foods, mostly plants, if not all of plants. So how to do that? Yes, that's a conversation that really needs to be done individually or, in a small group setting. The second thing I really think is sleep. You need to sleep. You need to really try to focus on your sleep. You need to try to get 7 to 9 hours of sleep as an adult, and more if you're a child or younger. I focus on exercise. Somebody, I think in the chat, asked about inflammation and exercise. People ask me about exercise a lot of times. You need to exercise. We want people to move. Do you need to move? Our guidelines for cardiac disease say you have to exercise a load. And somebody who's never exercised, I don't ask people to do 150 minutes of exercise. I tell them, why don't you start with 5 minutes of exercise or 10 minutes of exercise? We start out small. Does it have to be walking? No. Does it have to be jogging? No. Can it be in the chair? Absolutely. I have some patients that can't exercise because they have severe arthritis or they have amputations or different reasons they can't exercise. So we do sitting exercises. There's things you can do in your while you're sitting. 1, 2, 3. You can do things with your thighs if you can't use your knees. And there's so many things you can do in terms of exercise. And absolutely starting small. You got to walk before you run, so to speak. Don't try to do things that are beyond what you're normally, if you've never done nothing, you don't need to be doing 150 minutes, but just start here with 5 or 10 minutes and see if you can do that for 2 weeks and then build up. One of my patients told me that the reason she started to exercise exercise is because I made it easy for her. She said, because I made it seem like I can do 5 minutes. Like, what's wrong with 5 minutes? I can do that. And so then she's now up to 20 minutes of exercise every day. So those are sort of things. So exercise, sleep, diet. There's avoiding stressors, try to avoid emotional stress, social media stress. I tell people to put their phones on do not disturb starting 10 o'clock at night. Do not touch your phone again till the morning. And not when you first before you get out of bed. No, you should get out of bed, do all your normal day-to-day morning stuff. And then if you need to check the news or whatever, but there should be a concentrated amount of time where you don't use your phone. Sleep, exercise, treating the gut, eating mostly plant-based, a lot of sort of mind-body techniques. Those are things that you can do, like yoga and meditation, which I do a lot of in my clinic. All of those things are really good for healing the body.
Top tips. Definitely focusing on sleep, exercise, and start slow. We also like to stress it that just do whatever you can and use the stairs instead of using the elevator. That's a good start already. And just movement on a daily basis, and a whole food plant-based diet has definitely helped myself and quite a lot of patients. So couldn't recommend it more. And your book highlights so many other very practical steps that we can take to bring into our lifestyle that are not hard and actually really economical. From a food point of view, it is much cheaper to be on a whole food plant-based diet than eating meat, steaks, fish, isn't it?
Yeah, I mean, this is a topic that comes up a lot where people will say, well, it's more expensive to eat vegetables. It is and it isn't. I agree that like organic raspberries are ridiculously expensive, but doesn't mean that we need to be all eating organic. So, do we need to eat organic? Well, yeah, it'd be nice, but not everybody. I mean, I have 3 kids. My son is 6'2". He can eat a box of raspberries in 3 seconds, and they're $6, $6 for a thing of raspberries organic. Like, it's ridiculous. So, and so what I get it, and so you do the best you can. If you eat frozen, if it's not fresh, a lot of the welfare programs we have in the US, they support farmers markets. And so I always tell my patients, like, okay, if it's expensive and you have some of these SNAP programs, the farmers markets are all supporting those programs. And so eat frozen if you can't eat fresh. Don't worry about organic if you can't get organic. Just try to eat as many plants as you can. People forget that a bag of beans is like $2, and a bag of beans you soak them overnight, you put them in a pressure cooker, and you can feed your family for 5 days. Now, I know this stuff because I have 3 kids. I told you my son is 6'2". I have 2 growing daughters. I have a husband that's massive. I have like all these people in my house that I feed. And so, but I use this amazing thing called the Instapot, which is like the best thing that is existed in my life. And this electric pressure cooker, you put those beans in for $2, and I can feed my family for 3 days on those beans. I mean, they may not be happy about it.
You can definitely make it very, very tasty. That's what I found. It just takes a little bit of relearning. Well, I'm just conscious of time. Honestly, we could talk to you the whole day and take all these incredible tips. But I highly recommend your book, Body on Fire, which actually goes through all of the problems that we are facing, up-to-date research. And not only that, it's really easy packaged practical steps are in there that from kids to adults, the whole family can tap into to live a longer and more fulfilling life without chronic diseases. Thank you very much.
No. And I say I'm happy to be here. And I would just say, I wrote that book to honor my daughter. And I say that because that book is to say to everyone out there who's ever felt like I have, or even a smidge of what I felt, that angst and stress and debate and how you feel when you go so low. And it honors her because it says, you know what, you're the one who taught me all of these things, and it's because of you that I am where I am.
I hope she's watching this, and Thank you so much for coming today and for taking the time. And before we go to our 20 minutes, if you have with us, onto our non-recorded session where our guests can ask you questions,
Sure.
we'd just like to share your links here on the chat. Your website, your Instagram, you're also on Twitter, and your website is drmonicaagarwal.com, where they can reach you on Instagram /Dr. Monica Agarwal, and on Twitter the same. So we are going to go off for just a few minutes of chat with you. Thank you very much for everybody joining us on YouTube, Facebook, and Instagram. If you are new to us and you would like to join this conversation and have any questions, join our membership on our website, afternoonteawithdocs.com. It's completely free of charge. It is just a platform where you can continue this conversation. Thanks to everyone for joining, and see you next Sunday.
Are we doing, you want to do some questions now, you said?
It's gonna, sorry, it's technicality, just gonna
Oh,
stop
no problem.
and